if you're going to have accountability, you've got to have very specifically defined goals, And I know this is an area that many dentists struggle with because, we don't want to be, don't want our team members confused about where our priority is taking care of patients. And so I met many dentists that are afraid to share numbers or reluctant to share numbers with their team because they don't want the team to think that it's about the money. And I get that. I get it. I understand it. And I understand your concern about that. But we have to kind of go up a level and talk about what is the overall philosophy of your practice. And I'm going to suggest that an overall philosophy that is a winning philosophy is to take care of patients the way you would like to be taken care of yourself, clinically and behaviorally. So that means clinically, we provide the quality of treatment that we would want, using the technology that we would want, using the materials that we would want, and the diagnosis that we would want. All that kind of falls under the clinical realm. And the behavioral realm, treating people the way we'd like to be treated, means that we provide the kind of experience that we want. We should always lead with those objectives. It's the patient-centric practice. It needs to be patient-centric. But once we've established that and we're clear about our behaviors matching up to that, kind of like our why, that's our why. Simon Sinek, start with why. That's our why. Our why is to honor that philosophy of taking care of patients the way we'd like to be taken care of, be clinically and behaviorally. By the way, that very much is the philosophy at LifeSmiles. And you're welcome to adopt that. You're welcome to adopt that in your own practice. But once you've established that, then I think it's okay to talk about the numbers, because the numbers don't become the reason we do things. They become the byproduct of what we do, not the reason for doing them. And that's a very important distinction. They become the byproduct of what we do, the result of what we do, not the reason for what we do. It's been said before in the world of management is that you can't manage what you don't measure. You cannot manage what you don't measure. Naren, do you believe that to be true?
Absolutely.
Yeah. Do you remember who first said that?
You can't manage. Is it the management guru? Peter Drucker.
Peter Drucker, the father of the science of management famously said, you cannot manage what you don't measure. And I believe that to be true. But you've got to have the philosophy in place above that before you start talking about the granular details of measurement. But you've got to have specific goals. For example, a doctor production goal on a daily basis, a daily doctor production goal, because how in the world can your scheduling coordinator help you achieve that goal if she doesn't know what that goal is? Her concept may be to schedule the day full. In other words, to fill in names and schedule the day full. But we all know that there's a difference between being busy and being productive. You could have a full day and quite literally at the end of the day feel like a truck ran over you. And yet you look at your day sheet and you discover you didn't cover the electric bill in your practice that day.
Talking about
another day where, it just was nicely paced and you're thinking, gosh, I had a great day. At the end of the day, you look at the day sheet and you say, holy cow, this was a great day. And the two of those can exist side by side if you don't have specific goals.
I had an interesting experience today, Gary. I had a meeting with a client, and of course, when I have meetings, I'm focused on helping them make the next 3 months, 6 months, 1 year better than the last 3 and 6. Because I know if I do that, like 95% of our clients, they will stay with us every year. So this particular practice, I'm not going to mention male, female, etc. They're doing really well for Google. They're ranking for 200 keywords. The phone is ringing, but I saw a couple of opportunities. The big one I saw is 46% of the calls that are coming in are not being answered, right? And immediately,
quite literally. And let me ask you a question: is that 24 hours a day, or is that during business hours?
Just business hours. Just business hours. Just during business hours, like 9 to 5, Monday through Friday. 46% of the calls that are coming in are not being answered.
And we can almost say, round up, half of the calls that are coming in aren't being answered.
Not being answered. So I said, we need to work on it. I said, our best clients, our A clients, only miss 10% of the calls during business hours. So I want you to be an A. This lady who's the owner, I think she also answers the calls once in a while, got very defensive. And it's almost like she doesn't want to look at that. Like, no, that's not a problem. It's all taken care of. I'm like, I know you call them back. I know you follow up, but the moment is when they call you, not when you call them back, when they're excited, right? I mean, Cialdini, psychology, so I don't need to.
Well, if they call them back later, that person's already found another dentist.
Yeah, they're not interested. They're busy thinking about something else. And more than likely, like you said, they've already found another dentist.
Because all they did was go to the next office on Google search.
Exactly. So my question is, like we talked about at the beginning, there are those extremes, right? The accountability driven practice, that's the top 5% practice, and then pretty much everybody else. How come a lot of people have a hard time embracing metrics, embracing accountability? It's
outside of the realm of someone that was professionally trained clinically.
Right.
Although there's metrics to measure how they're doing in terms of their clinical treatment. But that's something that they've had many years of experience with, and this is kind of outside of their realm of comfort.